Today is May 20th, 2025. Countries have just signed a treaty aimed at preventing future pandemics. The big question now is, will these promises hold up when another virus crosses borders?
Yesterday, the World Health Assembly approved the first-ever international pandemic treaty. After years of debate, what does this agreement actually do?
At its core, the treaty sets up a formal system for countries to work together on pandemic prevention, preparedness, and response. It was shaped by the failures and inequalities we saw during COVID-19. Remember when some countries had access to vaccines right away and others waited for months? This agreement tries to address that.
So does this mean everyone would get vaccines and treatments at the same time now?
It doesn't quite guarantee that, but it does put a framework in place. Countries agree to share vaccines, diagnostics, and treatments through an equitable access mechanism. There's also a network for global supply chains and a financial pool to help countries without enough resources.
But how would this actually work, especially when there's pressure? We've seen international promises fall apart before.
That's a fair concern. Getting to this point took 3 years and 13 rounds of negotiations. Now, each country has to sign and ratify the treaty on its own. That brings in complications, especially with internal politics. Some governments might hesitate, worrying about sovereignty or costs.
About sovereignty, does the treaty give the World Health Organization any authority to override a country's laws?
No, and that's important. The treaty makes it clear that the WHO doesn't get power to order or mandate national actions. Each country still controls its own policies, whether that's lockdowns, vaccine rules, or travel bans.
So in practice, it's more like a voluntary code than a set of international laws, right?
Exactly. It acts as a playbook. Countries agree to share information, coordinate responses, and follow shared standards. But no one is forced to act in a specific way.
On the science side, there's mention of a new pathogen sharing system. How is that supposed to work?
The idea is that if a country detects a new virus, it shares samples and genetic data quickly with the rest of the world. In exchange, the benefits, like access to vaccines or treatments, are distributed more fairly. It's meant to avoid situations where some countries are left out.
And what about manufacturing? The last pandemic showed that when production is concentrated, supplies get bottlenecked.
The treaty addresses that by encouraging technology transfer and building capacity in more places. The goal is to have vaccine and drug development happening in more countries, not just a few wealthy ones.
I saw something about a global emergency workforce. Is that sort of like UN peacekeepers, good for health emergencies?
In a sense, yes. It's a framework for quickly sending trained health workers where they're needed most. The hope is to avoid delays in response, like the ones we saw early in COVID-19.
All of this sounds ambitious, but will every country actually stick to it?
That's the big test. After this adoption phase, each country has to sign and then ratify the treaty. Some might move quickly, others could take months or even years. And even then, it all comes down to trust, transparency, and political will. Will countries share data when it's inconvenient? Will they commit resources when budgets are tight?
Funding for low and middle-income countries. How does the treaty address that?
There's a coordinating financial mechanism that pools resources to help countries improve surveillance, labs, and distribution systems. The idea is to prevent the kind of disparities we saw last time.
Does this treaty set an example for other global challenges, like climate change or cybersecurity?
It might. It shows that countries can come together on complex, high-stakes issues. But pandemics are unique. Everyone is vulnerable, so there's a strong shared incentive. Whether this model works for other problems is still an open question.
So, to sum up, we have a new treaty, a global playbook for cooperation, but with national control. The world is more prepared, but what really matters is how countries follow through.
That's right. This is a historic step, but the real work starts now. Ratification, implementation, and building the trust and capacity to make it work.
The next pandemic will show if these commitments hold up under real pressure.
That's what we'll all be watching. Thanks for joining us as we dig into this new treaty and its possible impact on global health.
We'll be back soon with more stories about the issues that shape our lives and responses to global challenges. Thanks for listening. This episode was powered by mynews.studio. Try it now for free.